Hello everyone. Today we'll be talking about a common problem, that's fever. In that particularly periodic fever syndrome. And today we have Dr. Shushma, who is pediatric rheumatologist. Hi ma'am.
Hello.
And ma'am, can we know about periodic fever syndrome?
Sure. Fever is a very common problem among children. Like parents come to you every day, like most of the times with fever. So fever most of the times occurs due to infections. So it could be viral, bacterial, or anything. But sometimes when immunity misbehaves, if the balance in the immunity is lost, then also we can have something called as periodic fever syndrome, wherein the fever occurs periodically, like a clockwork, like once in 4 to 6 weeks or so. Along with fever, there can be other associated symptoms as well. So if it occurs periodically, we might think beyond infection. That is what is periodic fever syndrome.
Ma'am, what are the causes of this periodic fever syndrome?
Yeah. So we have our immune system that is designed to protect us from infections. In that we have two types. One is the adaptive system, that is when a bacteria or virus enters our body, we fight against it by producing something called as antibodies. We have another system called as innate immune system, that is by birth. It's like a rapid response team. So whenever there is an emergency, the rapid response team comes in picture and they release certain inflammatory signals. And these cause these symptoms of fever, rash, joint pain, abdominal pain, or enlarged lymph nodes for that matter. Because this activation occurs periodically, these symptoms also occur periodically. And this is the reason for periodic fever syndromes.
Ma'am, in periodic fever syndrome, what are the common fevers like observed?
Okay. So among young children, especially less than 5 years of age, we have this common problem called PFAPA or PFAPA, wherein there is fever of short period like 3 to 5 days every month, and child also has oral ulcers or sore throat as well. The good thing is that children are completely normal in between these episodes, and also they grow normally. And also this PFAPA condition is kind of mild, wherein children, it does not have any long-term sequelae as such.
Then all the fevers in this syndrome are mild enough?
No, we can't say that. So not all periodic fever syndromes can be harmless. Certain conditions, certain genetic condition like familial Mediterranean fever, wherein there is fever once a month along with severe abdominal pain or maybe joint pain. This in the long term, if not treated, can cause some kidney issues called amyloidosis. So, but the good thing is that it responds very well to a small medicine called colchicine. So we can't say that all periodic fever syndromes are harmless. We have to be careful.
Ma'am, whenever the child falls sick by fever, parents usually take antibiotics and give them. What do you say about this concept?
So fever is a symptom. It is not a disease. So fever could be because of various reasons, and just now we learned immune misbehaving can also lead to fever. So if it is due to infections, we might have to give antibiotics, but not all infections need antibiotics. If it's a viral infection, that is, you see that 1 or 2% in the family also has fever, they have some prodromal symptoms of body pain, running nose. This could be because of viral fever. It gets better with 3 to 4 days and you don't have to give antibiotics for that. But if it is due to a bacterial infection, usually there is like a cough with sputum or anything like focused symptoms, then we'll have to prescribe antibiotics according to the infection that we are suspecting. But here in periodic fever syndromes, the problem is with the immunity, not an infection. So we do not need antibiotics for this particular condition. But unfortunately, most of the children who come to us being referred late, they would have received multiple course of antibiotics, might have undergone multiple investigations and must have had hospital admissions also, which is very unfortunate.
Ma'am, usually they say this periodic fever syndrome is a rare disease. If it is rare, why we need to be worried like if it is rare?
Okay, that's a good question. So it is rare until it happens to our own child or someone we know.
Why?
So, and also as we see individually, these diseases might be rare, but in generally thousands of children might be suffering from these diseases. So we still have to keep that in consideration.
Now we understood everything about the periodic fever syndrome. And what you would give the conclusion for the parents and also some advices for the patients, also the parents, to be considered when they fall sick with periodic fever syndrome.
Okay, so as we discussed, we should understand that not all fever is due to infection.
Yes.
And we start by noting down the fever pattern, because here there is no one particular test that we do and diagnose. It is the clinical pattern that really helps us doctors to diagnose this. So parents can just start by noting down the fever in a chart or a calendar, like when it starts and the associated symptoms, how long did it last, and when was the child free of fever. And once we diagnose this periodicity, it really helps us. And also note down associated symptoms, if there are any joint pains, rashes, sore throat, or any lymph nodes being enlarged. So by doing this, parents can help us in diagnosing this early so that we can prevent any long-term problems.
That was really nice information. Thank you so much.
Thank you.